Welcome to this Tutor to You Sociology topic video looking at sociological perspectives of health, focusing on postmodernism and health. Postmodern views of health are concerned with the changes to medicine and the choice of medicines that have occurred in the postmodern era, including increased choice of medical interventions that are available to individuals as a result of a globalized health industry. Unlike structural theories, they reject the broad explanations of health inequalities in society and how social determinants of health impact on individuals, seeing these as meta-narratives, and instead focus on the more diverse range of explanations for individuals' health, how individuals perceive different forms of illness, and how the body, health, and illness are constructed by individuals rather than being dictated by social norms. They particularly focus on the increased use of complementary and alternative medicines that are a result of increased globalization and more knowledge of medical procedures and the dangers of medicalization. Furthermore, they examine the power relationships between patients and medical professionals and how these are changing in contemporary society. One area of focus is on the increased choice of medical interventions that are available to individuals in society. One reason for this is the globalized health industry, which has given people more information about treatments, particularly through the internet. Furthermore, they point to changes within the NHS that have meant that patients are able to utilize booking systems and schedule their own appointments and treatments, as well as being given a wider range of options on how their specific condition can be treated. Another factor that influences the choice available to patients is the growth of health tourism and how individuals can travel overseas for treatments at a lower cost than in their home nations. For example, the growth of cosmetic treatments in countries such as Turkey. Furthermore, they examine the growth of complementary and alternative medicines, which has been linked to the increased globalization of society. Treatments such as the use of homeopathy, meditation, and the use of natural and essential oils for pain relief have grown as a result of globalization and the ease with which treatments can be performed in the UK. Postmodernists present the idea that in contemporary society, many people have come to reject the meta-narratives of society, and this is also true in terms of health. Health practices and science in general are seen as meta-narratives, and these are pushed by other theories such as Marxism, functionalism, and to a lesser extent, feminism. Individuals have more knowledge, and as a result of the internet, this means they are increasingly questioning narratives around health and science, for example, movements against vaccinations and COVID conspiracies. But this also has practical applications. As people are better informed about health and nutrition, it has altered the power balance between medical professionals and patients, with many patients using websites such as the NHS to self-diagnose before seeking medical consultations. Postmodernists are also critical of medicalization as a meta-narrative and how psychological complaints such as anxiety or addiction are being treated through drug treatments rather than more holistic therapies. Globalization has also led to an increase in complementary and alternative medicines, and the growth of this industry over the past 30 years has been exponential. Many people now choose to use more natural remedies to deal with common ailments, and again we can link this to both globalization and the internet generation. Postmodernists argue that the rejection of science and the dangers of pharmaceutical medicines, particularly iatrogenesis, has seen an increase in people opting for alternative therapies such as homeopathy, meditation, and hypnotherapy rather than drug treatments. Ernst argues that this is a symptom of patients' loss of faith in the biomedical model, particularly in light of the damaging side effects of some medical forms of treatment. A final area of concern for postmodernists is the interactions between patients and medical professionals. Historically, Foucault argues there was a power imbalance between the patient and the professional, with the role of the medical professional being to conduct surveillance on the patient to ensure they were adhering to the norms and values of society, not overindulging in drugs and alcohol, controlling sexual behaviours, for example. However, now people are more involved in self-surveillance, particularly through the use of smart technologies. People are able to monitor the heart rate and oxygen levels through smartwatches. Individuals monitor their diets through calorie counting and the amounts of key nutrients that they intake. Whilst people have rejected science as a meta-narrative, the use of science and technology has led people to individualize their health plans for exercise, nutrition, and knowledge of what supplements and vitamins will give them more energy. This is linked into the growth of alternative therapies, and it has changed the relationship with professionals to be one where doctors are visited through necessity rather than regular checkups. Even this process has changed through online and telephone consultations, giving individuals more control over how they access medical professionals. However, postmodern views are criticised. The majority of individuals still subscribe to the biomedical models of treatment and the use of pharmaceutical drugs as the first source of treatment. This is certainly the case when examining mental health, as despite the broad range of well-being tools available, over 84 million prescriptions for antidepressants are issued in the UK each year, and it's estimated that 7.9 million adults in the UK are on some form of antidepressant medication. Furthermore, while postmodernists discuss the idea of greater choice, this is still largely limited based upon age and geographical location, with postcode lotteries for many services, particularly mental health services, meaning there are vast differences between the availability of treatments across the UK. However, as postmodernists suggest, there has been a rise in the popularity of individuals using complementary and alternative medicines, with the global market for complementary and alternative medicines being estimated to be worth around $100 billion per year in 2021. That concludes this Tutor to You Sociology topic video looking at sociological perspectives of health, focusing on postmodernism. Thanks for watching.